It is Medical Monday. Today we're talking about motion preservation surgery with Dr. Marc Moisi. He's Director of Neurosurgery at Hurley Medical Center. First off, good morning to you.
Good morning. Thanks for having me again.
Yeah, thanks for coming in. Tell me a little bit about this surgery. I've never heard of it.
So as you know, there's a lot of back pain and neck pain in our society. And the go-to, it seems, for many years was fusions. Well, over the last decade or so, there's been a lot of advances, and now the whole point of our joints in our body is to preserve motion. Now we could provide that surgery for our patients as well.
Interesting. So talk about some of those advancements then. What do you do?
So the surgery itself is the same as you would for a fusion. The main point of the surgery is what footprint you leave. The goal is to preserve the motion of the surgery, and you put in an artificial disc instead of rods and screws to preserve that motion for these patients in order for them to be able to really move their necks as they typically would if they hadn't had the surgery, but without the pain.
Well, now bigger picture here, how does this really maybe improve quality of life, or what makes this a better option?
So what this does for our patients is twofold. One is you preserve the motion. Secondly, you don't deteriorate the levels above and below, which is sometimes one of the instances that would happen if you were to fuse that one level. Because you create a rigid form, and instead you just let the body do what it does naturally for itself and create a happy medium for the patient.
All right, and I'm told to ask you here, degenerative disc disease, let's talk about that. It really isn't a disease.
So degenerative disc disease isn't a disease like you would expect, like heart disease or diabetes. What I call it, it's the wrinkles and gray hairs of the spine. We all deal with it because we live on Earth and there's gravity on Earth. And there's some deterioration. However, with degenerative disc disease, the cure, I try to call it a cure and a modality to do physical therapy and other modalities that are conservative management. And at the Hurley Neurological Center, we move towards conservative management, and that's how we try to treat our patients prior to moving to a surgical intervention.
Gotcha. So overall, the goal here, though, is just to keep folks moving longer, right?
To keep them moving longer, enjoying life, because that's why we're here, and to enjoy their regular everyday activities, as well as to enjoy their family and friends.
Well, and talk about, I guess, some of that success that you are seeing with this.
Absolutely. So a lot of these patients tend to leave the hospital a lot quicker and back to their everyday activities and a lot sooner than someone who would have a fusion and would have to have some motion restriction. We want them to do their everyday movements and motions to enjoy and maintain their life quality.
Well, and what does that mean to you personally, considering what you do?
I love it. I love showing up to clinic and seeing patients that are doing well, smiling. We recently had a patient that went and ran a half marathon 87 days from surgery.
Oh, wow. Yeah, so that speaks for itself right there. Interesting to consider again with motion preservation surgery. We appreciate your expertise, Dr. Marc Moisi there, Director of Neurosurgery at Hurley Medical Center. You can always find out more by going to the website there on your screen. But thanks for filling us in this morning. We appreciate it.
Thank you for having me.
Yeah, good to see you.